Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Is Triamcinolone good for poison ivy? Overview. Steroid prescription creams or ointments like high-potency triamcinolone 0.5% may be helpful during the first few days of a poison ivy rash on a small area, but have little effect once the fluid-filled blisters have appeared. Over-the-counter, OTC, products like hydrocortisone cream 1% are not usually strong enough for poison ivy. Your doctor may prescribe oral prednisone tablets for a more severe rash. Stronger, super high potency prescription ointments or creams like betamethasone 0.05% or Clobetasol 0.05% may also be preferred by your healthcare provider. Do not use steroid creams on your face, groin, or axillae, underarm, armpit, unless directed by your doctor. Do not cover the treated skin area with a bandage or other covering unless your doctor tells you to. Steroid injections, triamcinolone, budesonide, or prescription pills, prednisone, may be used instead by your doctor for a more extensive or severe rash or if it is on your face or genitals. Pills are usually continued for 2 to 3 weeks, with the dosage slowly decreased over time. Shorter course oral steroids like methylprednisolone, for example, Medrol dose pack, may result in your symptoms reappearing. How do I apply topical triamcinolone? Topical triamcinolone 0.5% cream is for your skin, topical. First, wash your hands before using triamcinolone topical, unless you are using this medicine to treat the skin on your hands. Apply a thin layer of medicine to the area of skin as directed by your doctor. Wash your hands again after application. Usually this medicine is applied to the affected areas 2 to 3 times a day. Always apply as directed by your doctor. Do not apply this medicine over a large area or cover with a bandage or wrap unless directed to do this by your doctor. Covering treated areas can increase the absorption of the medicine through your skin and may cause harmful side effects. Stop treatment when directed by your doctor. Do not use it for a shorter or longer period of time. Call your healthcare provider if your symptoms do not improve or get worse, or if you have further questions or concerns. Only use this product on a child if directed by the child's doctor. How do I know if I have poison ivy? Initially, poison ivy causes a red rash with intense itching. Later, skin swelling and blisters, which may be fluid-filled, may appear in a streak-like pattern where the plant oils brush the skin. For most people, poison ivy symptoms usually clear up in 2 to 3 weeks and don't need treatment by a healthcare provider. However, many treatments can relieve the symptoms like itching and swelling. Home remedies may help, but some people may need to see the doctor for prescription treatments. Learn more, pictures of a poison ivy rash. Contact your healthcare provider or go to urgent care right away if you are not sure if you have poison ivy. Your rash is severe or covers most of your body. You have poison ivy on your face, around your mouth or eyes, around your groin area or genitals. You have swelling in your legs and arms. You have tender, swollen glands on the sides of your neck. You have swelling, infection, soft yellow scabs, severe pain or fever. The itching or pain keeps you awake at night. Your rash lasts longer than 2 weeks. Call 911 or seek immediate emergency medical care if you have shortness of breath, trouble swallowing, or the rash covers a large part of your body. If you are not sure if you have poison ivy, see your doctor or go to an urgent care clinic. A healthcare provider can usually identify poison ivy by just looking at the rash, assessing your history of exposure, and reviewing your symptoms. Related questions: where should you not use triamcinolone acetonide cream? Is triamcinolone acetonide an antifungal cream? Clobetasol versus triamcinolone, how do they compare? What is poison ivy? Poison ivy, Toxicodendron radicans, is a plant with 3 bright green leaves on each stem. The leaves turn red in the fall. It grows as a shrub or vine, in the woods or areas of dense undergrowth. Contact with the plant oil called urushiol can cause an itchy, painful and red rash on your skin, and is considered an allergic contact dermatitis. You can get a rash from touching any part of the plant, including the leaves, stem, vine, roots, flowers, and berries. The oil can also remain on clothes or shoes, camping gear, gardening tools, athletic gear, and pet fur and cause a reaction a few days or even weeks later. Other related plants, such as poison oak and poison sumac, can also cause similar allergic dermatitis. These plants are found widespread throughout the United States. Poison oak also has 3 leaves, while poison sumac may have up to 7 to 13 leaves, which turn reddish-orange in the fall. What home remedies can I use for poison ivy? Most cases of poison ivy don't need to be treated by a doctor. There are several home remedies or over-the-counter treatments you can use to help relieve symptoms like itching and redness. These include colloidal oatmeal baths, for example, Aveeno, cool, wet compresses. Calamine lotion, for example, Caladril, medicated soaks like Boros solution or Dome Boros once the blisters begin to weep. Do not use topical antihistamine creams or lotions, skin numbing creams, or over-the-counter, OTC, antibiotic creams on the poison ivy rash unless directed by your doctor. These creams or ointments could make the rash worse or cause allergic reactions. Can I use Benadryl for poison ivy? Antihistamines like oral diphenhydramine, Benadryl, are not helpful for the itching from a poison ivy rash because histamine is not responsible for the itch. However, if you are having trouble sleeping due to intense itching, your doctor may recommend oral diphenhydramine at bedtime. It causes drowsiness as a side effect, which may help you get some rest, but may cause daytime drowsiness as well. Bottom line. Triamcinolone 0.5% cream or ointment can be used to treat poison ivy, if prescribed by your doctor for this use. It is considered a high-potency corticosteroid. Follow your prescriber's directions for use. If your skin condition does not improve after 2 weeks, contact your doctor for further instructions. Home remedies such as colloidal oatmeal baths, cool compresses and calamine lotion can offer relief from symptoms. If your rash is extensive or on your face or genitals, you have shortness of breath, trouble swallowing, contact a healthcare provider right away. This is not all the information you need to know about Triamcinolone for safe and effective use. Review their full product information and discuss this information and any questions you have with your doctor or other healthcare provider, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.